Good day everyone. As we progress in an era wherein all things are advanced, different biological and ethical issues that arise from the emergence and development of the life sciences are still relevant. I am Frank Mark V. Cristobal, a biological sciences student from Philippine Normal University, North Luzon, and I'll be talking about in vitro fertilization. Does any one of you familiar with in vitro fertilization? Well, modern society requires modern ways of living. In vitro fertilization is a process of fertilization where an egg is combined with a sperm in vitro. The process involves monitoring and stimulating a woman's ovulatory process, removing an ovum or ova from her ovaries, and letting sperm fertilize them in a culture medium in a laboratory. To fully understand the concept of in vitro fertilization, let us go back how the normal way of producing a baby. Pregnancy has many steps. The sperm and an egg start everything. Testicles produce microscopic sperm mixes with other fluids to make semen, which is ejaculated. Every time men ejaculate, millions of sperms are released, but it only takes one to fertilize an egg. Hormones that controls women's menstrual cycle mature a few eggs each month. Mature eggs are ready to be fertilized by a sperm. These hormones thicken your uterine lining, preparing the body for pregnancy. Fertilization is when sperm joins an egg. If sperm joins the egg, the fertilized egg travels down the fallopian tube to the uterus. As it divides, it forms a ball. The blastocyst arrives from 3 to 4 days after fertilization. The cell ball floats for 2 to 3 days. When the cell ball attaches to the uterine lining, pregnancy begins. In IVF patients, mature eggs are collected or retrieved from the ovaries and fertilized in a lump with sperm. The fertilized egg or eggs are then placed in the uterus. A full IVF cycle takes about 3 weeks. When these steps are divided into sections, the process can take longer. The procedure can be performed with the couple's eggs and sperm. Alternatively, IVF may use eggs or sperm or embryos from a known or anonymous donor. A gestational carrier or someone who has an embryo implanted in their uterus may be used in some cases. Moreover, fertilization in IVF can be attempted using two common methods: conventional insemination and intracytoplasmic sperm injection, or the ICSI. During conventional insemination, healthy sperm and mature eggs are mixed and incubated overnight, while in ICSI, a single healthy sperm is injected directly into each mature egg. ICSI is often used when semen quality or number is a problem or if fertilization attempts during prior IVF cycles fail. Often several good quality embryos will be created. In these cases, it is normally best practice to freeze the remaining embryos because putting two embryos back in the womb increases the chance of having twins or triplets, which carries health risks to both mother and the baby. You can use your frozen embryos later on if your first cycle is unsuccessful or you want to try for another baby. In light of the fact that approximately 1 in 8 heterosexual couples has difficulty conceiving and that homosexual couples and single parents frequently require clinical assistance to conceive, demand for IVF has increased. In vitro fertilization is a treatment for infertility or genetic issues per the Mayo Clinic. If IVF is performed to treat infertility, you and your partner may be able to try less invasive treatments such as fertility drugs to increase egg production or intrauterine insemination, a procedure in which sperm are placed directly into the uterus near the time of ovulation. It is before attempting IVF. IVF is also an option for individuals with certain health conditions. IVF may be an option, for instance, if you or your partner suffer from fallopian tube damage, ovulation disorders, endometriosis, uterine fibroids, previous tubal sterilization or removal, impaired sperm production, unexplained infertility, and genetic disorder or fertility preservation for health conditions. Do you know that on July 25, 1978, Louis Joy Brown, the world's first baby to be conceived in vitro fertilization, is born at Oldham and District General Hospital in Manchester, England, to parents Leslie and Peter Brown. So, before giving birth to Louise, Leslie Brown had suffered years of infertility due to blocked fallopian tubes. In November 1977, she underwent the then experimental IVF procedure. A mature egg was removed from her ovaries and combined in a laboratory dish with her husband's sperm to form an embryo. The embryo was then implanted into her uterus a few days later on. Her birth revolutionized the field of reproductive medicine. So today, IVF is currently regarded as a standard medical treatment for infertility. The procedure has resulted in the conception of hundreds of thousands of children around the world, in some cases using donor eggs and sperm. Here in the Philippines, there are known people who have undergone IVF. First, Fragrance Mogul Joel Cruz, known as the president and CEO of the popular perfume brand Aficionado, who had suffered from low sperm count and some abnormalities. Yet, he has always been a loving father to his 8 children, and they are all twins, conceived through in vitro fertilization and were birthed by the same surrogate mother. So another is celebrity doctor Vicky Bello and Hayden Ko. Introduced their daughter Scarlett Snow Bello, who was also conceived in vitro fertilization to an American-Mexican surrogate mother. Additionally, ethics in IVF has been brought up as it pertains to the ethical status of an embryo. This is because there is crucial distinction between a human life begins and when a person begins. Throughout the majority of human history, it was believed that a human only became a person at birth. Then, as embryology science progressed, it was argued that personhood emerged at the moment of the conception, a view that made sense given the available information at the time. Moreover, the quality of consent obtained from the parties, the motivation of the parents, the uses and implications of pre-implantation genetic diagnosis, the permissibility of sex selection, and the storage and disposition of surplus embryos are additional ethical issues raised by IVF. Furthermore, according to the Human Fertilization and Embryology Authority, IVF is generally very safe, and most women who undergo it have no health or pregnancy complications. Due to improved genetic testing, the delayed childbearing, increased accessibility, and decreasing costs, it is not inconceivable that IVF and related techniques could surpass natural reproduction in the future. Despite having unearthed ethical dilemmas, we can advance our understanding of them. Bioethics will help us decipher what is right and what is wrong. Again, I am Frank Mark V. Cristobal, and let me close with 2 words. Bioethics matters. Agyaman kanya tayo amin.